Welcome to another episode of Connecting with the Toms. I'm Julie,
I'm Dr. Tom.
and today we're going to take a deep dive into insomnia and the reasons why you might struggle with insomnia. But before we do that, we want to actually talk about what is sleep and why is it important. So I'm going to go to you, Dad, and you can go ahead and explain what is sleep and why is it important for us.
Well, it's certainly something that we all do. And we know from our previous podcast that it's something that's absolutely essential to life. And what most people don't realize is that if sleep is something that's very highly regulated, it's an active process and involves different areas of the brain. And we spend about 1/3 of our life sleeping, which is equivalent to about 25 years of our life is actually during sleep, which gives you the idea of how essential it is. Parents who have a new baby, unfortunately, will miss out about 6 months worth of sleep in their first 2 years of life. And that's pretty significant impact on their life, down the road. Sleeping less than 7 hours a night has been shown to reduce your life expectancy. So we talk about aging, we talk about anti-aging. One of the most critical things about that is to get at least 7 hours of sleep a day. And the other thing that seems to come up as we get older is people always could be concerned about weight gain. And they show that this research has shown that a lack of sleep can cause a weight gain of about 2 pounds or almost a kilo in less than 1 week of just getting poor sleep. Most people can survive, up to 2 months without eating, but people can only live up to 11 days, accordingly, without sleeping. The ability of the brain to tell you what's important is from what is not is compromised when we lack sleep. One of the things the other factor that is so common now is everybody seems to be is worried about cognitive impairment. Where it seems everybody has known somebody, a grandparent or a sibling or a parent who moving into a stage of dementia. And these memories are one of the reasons we sleep is because that's when memories get cemented in school. You burn more calories sleeping than you do watching television, which is like, wow, it's just an active process. I'm sleeping. I'm not burning anything, but you actually are, which is why you can gain weight if you're not sleeping. The occurrence of nightmares could be due to a variety of things, including something wrong with your heart, history of migraine headaches, sleep deprivation, certain medications like beta blockers associated with that. When we have sleep deprivation, we think of that. Is that jet lag? Is it having to get up early and go to the airport, catch an early flight that changes your routine? And, that's a pretty significant impact because it dramatically impairs our judgment and slows our reaction. And overall, drinking coffee or caffeine, rather, in the evening delays our brain's release of melatonin. Everybody is pretty familiar with melatonin because it often has become the knee-jerk reaction of, well, I don't want to take a sleeping pill, but I hear melatonin is something. Melatonin, yes, we'll talk about that more in detail. Is not just about sleep. It actually sets our immune system. It actually sets our whole circadian rhythm. So something really important. What we will need to mention. So just a couple of comments about. So, well, how much sleep did I get? I sleep 4.5 hours. I go to Tim Hortons or go to Starbucks in the morning. I stop by and I get a big latte, double espresso or whatever. It's going to keep me going all day, and drink another one at noon. You're probably in the state of sleep deprivation if you're using something like that to keep going. But for childhood and for kids, sleep ranges for a baby about 18 hours a day, which seems a lot, but that's what they need because their brain is developing so much, to about 9 hours a day for teenagers. And as an adult, the research is pretty much definitive that 7.5 hours is pretty much what's required. And so your day, therefore, should be set up accordingly so that you can pretty much maximize the fact with the rare occasion that say that you have to get up early for an airport or something like that. We do know that women's menstrual cycles can have a pretty big impact on sleep. We know that certainly pregnancy does. We know that certainly having a little baby in the house certainly does. So adults, 7.5, babies, 18, and then in between about 9 hours for teenagers. one of the challenges, and I suspect many people will listen to the podcast find that as they get older, people are using devices. They use an Oura Ring, they use a Fitbit, they use an Apple Watch, and it says, "Oh my gosh, I'm not getting any deep sleep anymore." Do we need deep sleep? Well, yes, because it's one of the 5 stages that we ultimately go through in order to sleep adequately over a period of time. So, there's these 5 stages. One of the stage that people are often the most familiar with, of course, is REM sleep, which usually occurs, about 80 to 100 minutes, ideally, of your total sleep time. That's when sleep sort of lightens and you go back to this stage 3 and stage 2. So ideally, everybody dreams. People say, I don't remember my dream. It's a stage when you have REM stands for rapid eye movement. It's a recurring sleep stage that we get through. It's the time that we mostly dream for what's going on. It does occur in other animals. If you have dogs and other pets in the house, you'll hear them sort of crying out at different times during the night. And we know that one of the reasons REM is important because that's what helps us consolidate our memories over time. So, sort of an overview. It's an important aspect of, and it's why it's one of the basic treatment guidelines that we have talked about previously, as to the absolute essential component that you can't fool Mother Nature, as we well know from just looking at the climate and how the climate has changed over this particular winter, depending on what part of the continent or the world that ultimately you're in. So that's sort of an overview as we lead into the whole idea of sleep disorders.
Okay, so instead of going to my doctor because I am not sleeping, what are 3 things that I can do to help me improve my sleep?
One of the most critical aspects is routine. We just said that, one of the aspects of one of the hormones that's made in the pineal gland is melatonin. And melatonin is an over the counter, you can get it at any health food store, and people will take it anywhere from 0.5 milligrams up to 20 milligrams actually for breast cancer patients, because it is recognized that it's how important it is for the immune system itself. So establishing a routine is absolutely critical. And the most important routine as far as sleep is concerned, of course, is going to bed more or less at the same time, give or take 30 or 45 minutes. The ideal time for circadian rhythm to go to sleep is between 10 and 11. Ideally, you're asleep by 11 p.m. And then when you add 7.5 hours to 11 o'clock, we're basically looking at getting up about 6:30, between 6:30 and 7. So asleep by 11, up between 6:30 and 11. Now, if your life requires you to be up earlier than that, it means you have to be asleep earlier than that. And if it requires you have to get up at 5 o'clock, then you're going to bed at 9, and you're basically trying to get to sleep by 10 or even 9:30 at the latest. So that absolutely is critical. Another critical aspect is to not eat within 3 hours of going to sleep. The reason is because when we eat and when we have food in our stomach, about 40% of our blood gets focused towards the digestive system in order to be able to digest things. But it's known that we actually don't get into the repair of our cells until about 6 hours after our last meal. So if you're eating an hour before you go to bed, so if you're eating a late dinner, let's say you're eating at 9 and you're trying to get to sleep by 11, you're not going to actually do much repair of any of your cells until 6 hours after that. So you're not going to be, getting the restorative type regeneration that's required for all healing ultimately that's going on. And another thing, because one of the issues with sleep is people may have to wake up and go to the bathroom, is, which is not that unusual, especially as we get a little bit older. So it may require that you restrict liquids maybe a little bit earlier in the evening. But more importantly, it's in order to support the gland that we're talking about, which is the pineal gland. It's essential that you sleep in pitch blackness. What turns the pineal gland on is the dark, and what turns it off is the light. So if you do have to get up during the night and go to the bathroom, then I recommend that you have no night lights on. You basically don't put anything in your path from your bed to the bathroom. You don't even need to really open your eyes to find the bathroom that when you know where it is. And so the more that you don't let any light into through your eyes, because that's going to shut off your pineal gland, it's going to start destroying your melatonin, which is essential for not only sleep, but also the immune system, also for setting your circadian rhythm. So have a regular routine of going to bed and getting up, ensuring that you're getting about 7.5 hours or more is the ideal for what's going on. You absolutely want to sleep in the dark and don't eat within 3 hours of going to bed are three of the most critical things that we can all do.
Is that I hear and see, and when I'm talking to people, is that, like they're trying to change and trying to get in that routine. They don't eat 3 hours before bed. They got the dark shades, they put an eye mask on or whatever. They lay in bed and they're wide awake and they can't do anything. So they're just like, how their mind's racing or whatever. What would you suggest that people do? They've got they got the dark, and then they're in bed at 10 p.m. or whatever, but they can't fall asleep. They can't sleep. Their mind's racing. What do you suggest people do there?
So that's the perfect example of why there are variety of different types of sleep, insomnia. And so that's when you start saying, one pill or one approach doesn't fit all. So the first thing is to try and identify, what type of insomnia do you have? Do you have what's called the initial insomnia where you can't fall asleep? Do you have mental insomnia where you wake up frequently from sleep? Or do you have terminal insomnia, which is you wake up early and you're not able to get back to sleep? Or do you have hyper insomnia where you have trouble staying awake during the day? Or maybe you have the fifth one, which is the parasomnia, which basically is shown through abnormal behaviors that occur during sleep. You wake up, sleepwalking, violent dreams, violent thrashing around, et cetera, et cetera. So when you have, what you just described as I'm just lying there, my mind is ruminating, that's telling you that there's another issue beyond the sleep problem. So now we start looking at, so what organ is it that basically is out of balance, or perhaps it's a portal, which organs? So normally I would tend to think that the first thing I would look at somebody is I would look at their heart rate variability, because it's probably likely that they're living in a sympathetic dominant place and their body is in the chronic flight fright aspect of things, and you can't turn their brain off. Normally we say that the sympathetic dominant place, or the sympathetic part of the nervous system, should be active about 60% of the day, which basically is your waking hours. And the parasympathetic, which is the place where you want to be when you're sleeping, should be about 40% of the day. And the 40% of the day includes your meal days and your meal times, because we need in order to digest food adequately. If we're in a sympathetic dominant place, we're really not going to get much value other than calories out of the meals, because you're turning off all your digestive juices. So we want to be parasympathetic for meals, and we want to be parasympathetic for the sleep. And so the constant, your mind active, your mind is restless all day long. We have a different issue. And so that needs to be addressed in a totally different way than just taking melatonin or GABA or one of the many over-the-counter things that people will try.
Okay, so what are some easy parasympathetic actions or activities that people can do to help elicit that state?
So we know that the major parasympathetic nerve in the body that we talk about all the time, that we previously talked about, of course, is the vagus nerve. And, we have a whole list of 20 different types of activities that you can do to try and support the vagus nerve. As simple as splashing cold water on your face, as simple as humming, as simple as singing a song, as simple as, doing some form of meditation, deep relaxation, those types of things. And I know you have a number of exercises that you do with your clients that you can speak to that are
Sure
in
do.
addition to supporting the vagus nerve.
Hmm. Definitely. Well, there's so many different ways. But yeah, you're right. Deep breathing, splashing water, humming, massage. Yeah, there are many, many, many different things. And so if you're interested in a list, I can put a list in the show notes if if you're looking at looking for some ideas. One question I have for you though is, when should we be practicing these activities? Should we be doing it while we're laying in bed, or should we be doing it throughout the day to try to get our body used to knowing what it feels like to get into a parasympathetic state? When do you suggest people do these things?
I think it's not a good idea to do it when you're lying in bed because it's like the proverbial the cart, the horse is already 3 miles down the road because you left the barn door open. So if you wait until you go to sleep to try and get into a state of relaxation, you're going to be more and more frustrated, which is going to rev up your sympathetic component of your nervous system even more. So all these activities that we're talking about are something that should be done throughout the day. The easiest way to start with is get into the parasympathetic state when you're eating your meals. Turn off the television, don't have a heavy duty conversation, and have a prayer before you eat, put your fork down, slow down the whole eating process and isn't just, satisfying a hunger activity. It's actually satisfying a physiologic need of what it is that we're talking about. So it's something that takes practice. It's something that we need to do on an everyday basis. Just as we're saying, sleep is something you need to do. It's essential for life. Get adequately at least 7.5 hours a day. Yes, obviously, when you do go to bed, until you can get this implemented into your lifestyle, it's something that's not going to happen overnight. That's why you have to practice it well beforehand before you get into the aspect of, oh, I'm lying here and I can't fall asleep.
Right. So what does somebody do if that's the case then?
So if you're lying there, the proverbial, the old, that the ones that your grandma told you to do is to drink a warm glass of milk. Basically, the whole idea with milk, of course, is calcium and magnesium specifically. So the simplest thing to do is, a lot of people have lactose intolerance or have a dairy sensitivity. So drinking a glass of milk would actually make things worse. However, there are lots of number of products on the market that have, liquid calcium magnesium as an example that's fairly rapidly absorbed. Of course, the form that I like to use is magnesium taurate because it's the most easily absorbed and the most efficient form of magnesium that you can use. It does get into the brain. Many other forms of magnesium that are available in the market, unfortunately, are great for musculoskeletal things. They don't really cross that blood-brain barrier. So magnesium taurate, the brand that we specifically use because I found it because of other things is Maglivers. It's a powder. You put a little bit of water, you drink it, 30 minutes or so before you go to bed to try and do that. So that's the easiest, one of the easiest ways, the first things to try. There's flower essences that people will try, the 5-flower remedy that maybe you had when you went to the dentist. People have anxiety about, that type of thing. There's different types of vitamins and minerals specifically. What you don't, for some people, they don't want to exercise later in the evening or drink coffee later in the evening because those tend to increase the sympathetic dominant place that people are in. So we need to look at our lifestyle. We need to look at the types of things that we do on an everyday basis. We need to look at how we're winding down in the evening. The other thing we haven't said yet is we know that people looking at screens before they go to bed is potentially not a good thing because that could have a negative impact. So trying to minimize Wi-Fi, which can interfere with, of course, if we have a grounding mat on our bed, a grounding sheet, which we've recommended before, is another very positive thing that you can be doing. When you're camping, just sleeping directly on the ground. We know how good people sleep when they're in Mother Nature on the ground because you're picking up that energy that Mother Nature is providing. So that would be some of the simplest things to get started with.
If you're someone that does struggle, to add on to what you're saying, something that, but for clients that do that, the clients that I've had that have had issues falling asleep, I actually have worked on acupressure points because I find that people are stuck in sympathetic. They often want to do something. So you're laying there, you're like, what do I want to do? Like just getting a mat's like, okay, great. But your mind's still going, it's still ruminating the whole bit. So something that can help elicit a parasympathetic response that I've noticed has been really successful with my clients is doing the golden triangle points on your wrist. So if you don't know what they are, there's basically, if you look at your wrist and you look at the second crease, like look at the second wrist crease. And then if you put if go right down the middle of your wrist, if you go slightly to the right, there's going to be a tender point there. And so what you do is you're just going to hold that point for about 3 to 6 breaths. So what we're going to do is we're going to actually, if you guys want to do it together, we can right now. But basically, you just find that point, go ahead and do it. If you're driving, obviously, please don't do it right now, but something that you can find. So look at that second wrist crease and then just go slightly to the right. And then what I want you to do, you should be a little bit tender. And then what we're going to do is you're just going to inhale and exhale and do that 2 more times at your pace, whatever feels good. So by taking doing the deep breath is going to elicit a parasympathetic response because it's activating the vagus nerve. By putting pressure on this point, it's going to actually, again, calm the meridian channels. So then you can do it on the right and then you're going to do it on the left. So 3 breaths there. And then the other point you're going to do is 3 fingers from your wrist crease and then right smack dab in the middle. It's pericardium 6. There, you're going to push your finger up towards your elbow and hold that point again for about 3 to 6 breaths. And then try that and see if that helps elicit a calming sensation for you. So that's something that I found when I am stressed. So when I travel, for instance, when I travel and I'm jet lagged, this is something that I can do the first night and it helps me kick back in because I do practice parasympathetic things on a day-to-day basis. But this one helps get my system back on track pretty easily. So that's just something I wanted to talk about that I've shared that with my clients and it's worked for many of them. And also something else has worked for me is doing a gratitude list, but using the alphabet. So what you do is you go through the alphabet and you say something you're grateful for that starts with the letter A. So I'm always like my Apple products. It's an easy one. It's yep, I'm grateful for my Apple products because I was able to communicate with the world and all that thing. So you go whatever A and you go B, C, D. Next thing you know, you may not be able to get through the whole alphabet. You'll fall asleep. So that's something too, when we practice gratitude, it's a great way to elicit a parasympathetic response. But one question I had, because my kid's still struggling with a little bit of jet lag. We did some traveling over the last couple of weeks, moving from 2 hours and 3 hour time zones. What advice do you have someone to help them get back on track when they're jet lagged?
There are the 2 most common things that I use with my patients when that situation is something that I learned a long time ago. One is the use of what we just mentioned about the magnesium chlorate, specifically manganese. So I would have people use it 4 hours before their flight left, just before their flight left. They're flying overseas and a long flight that's 4 hours into it. And then when they get to their destination, if it's simply a function of, within the US or Canada flight, maybe less than 5 hours, I would have them take half a pack of the hangovers before they left. And then when they arrived at their destination, they would take it again. If it's not bedtime, at their destination, they would take it again at bedtime and maybe for the next day. In addition to that, we actually found that using homeopathic thyroidine, we call it, actually something, because the thyroid is responsible for metabolism. And the combination of those 2 things, so taking, a potency, maybe a 30C strength of the thyroid when they leave, when they arrive, at bedtime, for a day or 2, is something that we found to be particularly beneficial in the long term for people to do that. We'll talk about a few types of supplement things, but that's the easiest, and that's what has proved to be the most effective. for dozens and dozens of people that I've used that for over the years.
Because I just went through it. Something that I didn't do those things actually. What I did is I actually used light. So I exposed my eyes to light and darkness. So I made sure that when I got back home, that I exposed my light, and I had to set my alarm and expose my eyes to the light to get back on track here. And that way I was able to reset my circadian rhythm, because light, like you said before, with the pineal gland, when you use light, it's actually one of the best ways to help set your circadian rhythm back on track. I talked about like falling asleep can be difficult, but what about those people who wake up between 3 and 5 a.m.? What would you say for those people?
Once again, now we're looking at potentially a different physiologic process that's going on in their body. And we also start looking at the Chinese clock as a way of trying to identify potentially which organ may be, we'll say, because the Chinese clock, the time between 1 and 3 a.m. is called liver time. And so if people are waking up during that hour, it generally suggests that the liver, there's a higher heightened level of activity going on in the liver. And so what it's probably indirectly could suggest that you should benefit from doing some form of liver support. The easiest liver support that anybody can do is to do a gastro in the evening, or if they've done it for a period of time, they can be wearing it the whole night with a castor holder in general. And if that's the time to wake up, that probably is the easiest thing to do. If they're doing a castor and dry skin brushing, and they're still not, and they're still waking up in that 1 to 3 time frame, then potentially we'll look at maybe giving them some form of a liver herbal medication at bedtime. So it's 2 or 3 hours before they go to bed, but it will be active by that period of time. If they're waking up between 3 and 5 a.m., that on the Chinese clock is the lung time. So now we're looking at a totally different organ system that we need to do. So, we'll be looking at breathing as one of probably the best activities that they can do, if they're waking up, since the lung is responsible for that, to again try and push them back into the rest of that parasympathetic place. But we'll also be looking at aspect of, instead of doing liver remedy when we go to bed, maybe we'll be doing some type of support for their physical lung, even though there's not necessarily a lung issue, but it could be a homeopathic remedy. It could be, something that's specifically built for the lung. And so the timing, and why are they waking up? Are they waking up because they're dreaming? Are they waking up because they have to go to the bathroom? Are they waking up because they're in pain? Or they're uncomfortable? Or their cat moved? Or their dog barked? Or what is it that ultimately woke them up? We still have to address whatever that issue is. And so waking up is not terrible. It's only terrible if you can't fall back to sleep. Then it's terrible in general. So depending on the individual cause, we have to address it. Probably one of the more common remedies that are done just generically, it's a very generic statement. If you have trouble falling asleep, the melatonin may prove to be effective, per se. If you have no trouble falling asleep but wake up in the middle of the night, you're going to find melatonin is of no value, because that's not the purpose of it. Because melatonin is to help you fall asleep. However, if you wake up in the middle of the night, especially if you're thinking about something, then GABA, which is another neurotransmitter, is the one that is proven to be probably generically the most effective. Melatonin doesn't help lots of people. GABA doesn't help lots of people. But if you're wondering where to start, melatonin, maybe 3 milligrams all dose would be a place to start. Or with GABA, maybe 700 milligrams taken at bedtime, maybe 2 of the things. But once again, you have to look at why are you waking up, what time are you waking up, how else can we support those types of things are probably the most generic things that we can recommend without going into specifics.
Can I just add, for me personally, when I do the castor pack, it elicits a parasympathetic response. Like, it makes me sleepy. So if you are going to look at doing castor oil packs, I mean, there's a lot of value in that. So that's something that you can definitely look into. But I want to add on to 3 to 5 p.m. Something that, from a supplement perspective, yes, for sure, depending on, you have to work with a doctor to figure out what's going on there. But in my experience, focusing on movement and whatnot, and working with so many different people, what I found is that people who wake up between 3 and 5 have dysfunctional breathing. So there are many different forms of dysfunctional breathing, and doing breathing exercises won't necessarily fix your dysfunctional breathing. So that's something that you need to acknowledge and something that you need to address first and foremost, because just telling you to take a deep breath, if you are someone that breathes into your chest and into your shoulders, that's not necessarily going to help you. So we want to be able to help you fix that dysfunction first and foremost. And that's exactly what I do. So if you want to dive into that a little bit more, you can check out my YouTube channel, or dive into my Mighty Network community online, because that's something that I address quite in depth, because it's paramount. Because I can't believe, I'm actually quite dumbfounded with the amount of people that breathe through their mouths still. And it's so important to stop breathing through your mouth. And so if you're somebody that does wake up in the middle of the night, you need to take a look at your breathing. Are you breathing through your nose? Are you breathing through your mouth? And I'm going to say you probably breathe through your mouth a little bit more than you think you do. And that's something that we need to address. So there's lots of different ways to do that. But just something that I wanted to add on there is that we need to fix your dysfunctional breathing if you're waking between 3 and 5.
So just that an additional point to that, Julie, is, one of the things we previously talked about, of course, is nebulizing. And so
Yes.
nebulizing is obviously one of the more important things to help people who have what they believe is congestion in their sinuses and their nose. So doing that, a casserole back and that before you go to bed may be a real bonus
Magic.
for those type of people who have that specific type of an issue.
Absolutely. Yep. I mean, there's, like I said, there's lots of different ways to do it, but just something that you need to take a deeper dive. If you're like, oh my God, I do wake up quite often between 3 and 5, then you really need to look at your breathing. That's sign number 1 right then and there. One question I do have is, why does sleep decrease as you age?
Why does sleep decrease as you age? It's a physiologic process, and you hear that a problem. And what I find often with these people, as people age, is they get all worried about it, and then they say, but they take a 2-hour nap during the day. I said, well, you're actually getting enough sleep, so if you don't worry about it so much, you probably will be fine. I would say it's simply a physiologic component. I think the other components that we talk about with aging is the fact that people more often have to get up during the night. Men with prostate enlargement may tell you that they may have to get up 3 or 4 times, even if they've restricted, fluid into the early evening. Now, there's other issues of why people may get up, but that's one of the more common ones. And then women commonly won't say the same type thing. And I would say probably some of that is relaxation of the muscles that are holding the bladder up. Maybe they've had a hysterectomy and they don't have that support to hold the bladder up, and they just have a sort of a weakness in that particular component. The other thing that as people age, we know is that when you get osteoarthritis, they have aches and pains. They have loss of collagen as we age. So the muscles, there's not good muscle tone throughout their body. So when they roll over, they're achy, they're sore, that wakes them up. They have different needs. So it's a physiologic aspect of it. So the goal is, if I don't sleep at nighttime and you're retired, just rest, sit down and, read a book. And if you take a nap, not a good show, because you'll be getting some of the rest that's required.
So are naps recommended?
They are recommended if people are certainly getting tired, it cannot carry on through the day. They're not recommended for younger people generally, if especially, or for anybody, if it basically prevents them from falling asleep at their regular normal time in the evening. So if you normally, as we've said, are to bed between 10 and 11 and between 6:30 and 7, getting your 7.5 hours. If you take a nap at between 4 and 5 after work or after school or whatever, but then you're awake till 1 or 2 in the morning, naps are not recommended in that case. However, if you take a nap in the afternoon or whenever, still can go to sleep normally between 10 and 11, then naps are just fine.
I read somewhere, or I don't know, I saw somewhere that you shouldn't nap more than 30 minutes because of the stages of sleep. So if you, yeah, like it to help you be more alert and wake you up, and the amount of sleep is you need. I think it's like it's between 20 and 30 minutes or something.
Yes, there's a true statement to that. So what and the simple question is, how do you feel when you wake up from a nap? If somebody says, "Oh, it's very rejuvenating," then you slept the amount of time. If somebody says, "Oh my God, I feel worse
Yeah.
because they've slept 2 hours," it's because they actually have slept into that deep state, which is what you don't want to do. You just want this brief regeneration, give you the energy back, and you are ready to go through the rest of the day and then go to sleep at your regular evening time.
Like, what is the definition of insomnia? So let's say I can't sleep for a couple nights and then I fall back. So is that really insomnia? If I have like irregular sleep patterns, I guess. Let's say there's a couple nights that I don't sleep well, but then and then I sleep a couple nights, I sleep well, and then I don't sleep well for a couple nights. Is that insomnia?
So I'll go back to sort of how it's laid out from a medical perspective. So what's called transient insomnia, it's basically it's felt to be less than 2 weeks. Intermittent insomnia is repetitive episodes of transient. So you're off and then you sleep good and then you're off, so good. So that's intermittent. But then chronic insomnia is basically is considered something where you basically are consistently never able to get more than they'll say 6 hours of sleep. It's a complaint causing distress, and usually we any type of chronic illness we consider it to be at least 3 to 6 months, which is then we put into the category of chronic insomnia. Or another way of considering it is if you have 3 episodes a week of taking longer than 30 minutes to fall asleep, you wake up during the night for at least an hour. So 3 times a week, you're doing that for an extended period of time. That absolutely is considered chronic insomnia. And, it's probably 50 million people who have that particular technical problem. And unfortunately, for the vast majority, they say upwards of 90% of those people remains unidentified and undiagnosed. And probably one of the most undiagnosed conditions is in our society is sleep apnea, which is a
Mm,
whole other topic all to
right.
talk about. And unless you're sleeping with somebody who is awake during the night and realizes that you actually stop breathing during the night, because if somebody's sleeping without somebody else in the room, they don't know that they stop breathing unless they sort of wake themselves up because of loud snoring and that type of thing. But sleep apnea is a pretty common, in fact, more than people realize, common problem that they have, and obviously is something that would need to be addressed. Perhaps you need to speak with a physician. Perhaps you would need a sleep study, or doing a nebulizing and then do mouth taping may
Mm.
actually be that simple solution for some people to be able to do that. That's why you have to make sure you can breathe through your nose needed before you do mouth taping, because you'll suffocate yourself otherwise.
Absolutely. I'm glad you brought that up because I think a lot of, I did used to talk about that a lot, and people are like, "Are you nuts?" And then they're like, "What kind of tape do you use?" And whatnot. And that's a thing that goes along with the dysfunctional breathing, because I didn't think I had dysfunctional breathing. I was a swimmer, but I realized when I'm like focused, I breathe through my mouth. When I'm tired, when I'm stressed, I breathe through my mouth. I'm like, oh la la. So when I did tape, I'm not lying. When I first did my tape breathing, I kissed my husband goodnight. I said, I hope I see you in the morning because I might die. Because I literally thought, I was like, oh my God, I don't know if I can do this. And your body will do what it needs to do to survive. So trust me, you're not going to suffocate. But, exploring and using different tapes was quite not revolutionary for me, but it changed the game. It really did change the game. And clients that I've recommended to, it has changed their breathing habits because it brings that awareness, especially when you're sleeping through the night. But yeah, so if I'm glad you brought that up, but tape your mouth, but be cautious. And so the tape, if you're wondering what tape I end up using, it's the first aid tape. If you use duct tape, your lips go so dry and you're like, oh my God, like the skin around your face is like raw and you're like, don't do that. Do not use duct tape around if you're going to mouth tape. But there is a company, they actually have, I think it's called Myotape. And they actually have, it's almost like rock tape or kinesiology tape. And they cut a little slit in it. So it goes around your mouth. So it has like a little hole. So it keeps your mouth closed. Specifically for kids, it's really, really good. Because if you notice, like my daughter is someone who struggles with anxiety. And believe it or not, folks, she struggles with mouth breathing. She's a mouth breather. And I know they're directly connected. So something that we're constantly working on is helping her breathe better. So something that I'm glad you brought that up. Is there anything else that you wanted to share about insomnia? So basically, just to recap, 3 things that people, if you struggle with insomnia, we need to take a little deeper dive. But if you're somebody that fits one of the categories that you just described, we want to focus on routine, light, and eating. Those are the 3 things. Is there anything else that you want to add if somebody does fit one of the categories of having insomnia?
Just once again, to sort of to finish this topic is, please don't think that, usually insomnia is no different than any other medical problem. There are probably 25 different medical conditions that are related to insomnia for all kinds of different reasons, and whether it's chronic pain or whether it's your cardiovascular system or whether it's your breathing, as we've talked about, or whether it's digestive problem because people have acid reflux, whether it's the general urinary system, whether it's your endocrine system because it's menopause or otherwise, or neurologic type problems, depression, anxiety, as you just talked about, post-traumatic stress. There's so many different reasons. And one that hopefully there are many, many medications that have the adverse effect of insomnia. And so if it's a chronic problem, instead of adding another prescription, check with your physician of any medications that you may be taking, whether or not they may be part of the problem. And if they are, obviously the goal would be to find a different one for whatever that specific need is. And I think people tend to overlook sometimes the obvious, just keep adding more things on, thinking that there must be something else that ultimately can do. It is a complex problem. We've tried to outline some of the more important things that you can do as an individual. No, we're not advocating that you immediately go to your physician and or the health food store necessarily and buy melatonin or GABA, unless that's something specifically that your physician has felt is a great benefit for your overall health problem. It's a huge problem in our society. As we said, probably 50, maybe 100 million people in this country. And I'm sure, there's lots of millions in Canada also who equally have the same type of issues that we've just been discussing.
Absolutely. At the end of the day, you're not alone. If this is something that you struggle with, you're not alone. And there are options other than just taking a pill. We need to ask a few more questions in terms of what's going on, what could be impacting it. And something that we haven't really discussed in this podcast is trauma and how trauma can actually impact your sleep and how it can impact your life. And the cool thing is that I'm excited to share is that my dad has recently written a book that discusses trauma. It's called Begin Again, and it dives into trauma, disease, and healing and uses a brain protocol and biological medicine. In our next podcast, we're actually going to take a deeper dive and discuss the impacts of trauma and how it affects your current health, because trauma is real, and trauma is something that we've all experienced to some degree, and it does affect your health. So we want to give it its own podcast, its own platform, so that we can take a deeper dive into that. So I'm really excited to check that out. But do you want to add anything else, Ed, about your book, or you want to talk a little bit about it? Give us a little sneak peek into what the next episode.
4 years of my life, 25 years of my medical experience of utilizing the protocols that I outline in the book for hundreds and hundreds and hundreds of people, and it was game changing for lots of people, to help them realize that what they experienced at some point earlier in their life has such a dramatic impact on their present health situation Our goal, of course, is to help them understand that and to move past it and to move to a higher quality of life for the rest of the years that they have on this planet. It will be available on my website, drdixontom.com. You'll be able to get it. You should be able to also find it on Amazon, etc. We're still in the process of getting all those details arranged, but hopefully by the time you take the deep dive, our next podcast, you'll have all those details sorted out. You can look forward to it.
Trauma is a big piece of the puzzle that not a lot of people have been talking about, and I'm excited to dive into your book and talk to you more about it and how it does impact people's health, because it's true, and there's lots of possible ways to help you heal that don't require drugs, that don't require big pharma to take over your life. So thank you so much for this chat on insomnia, Dad. Is there any parting thoughts that you want to add on insomnia?
Go to sleep on time, get those 7.5 hours, and your life will be so much better.
Right on, right on. All right. So I thank you so much all for being here and for sharing this time with us. And so please stay tuned for our next episode. We're going to discuss how your past traumas can affect your current state of health. Thanks so much for being here, and we'll talk to you soon.
Talk soon.